working with your supervisor, your human resource department to A, let them know what accommodations you need, B, see where their company or their workplace falls in the ADA categorization so that they could have a good idea of what they're entitled to, and then C, working with your counselor and your doctor to get that paperwork for accommodations.
Welcome to The Uptick, brought to you by the New Jersey Center for Tourette Syndrome and Associated Disorders, empowering children and adults through education, advocacy, and research by sharing the stories and experiences relevant to the TS community. Welcome back to The Uptick. I'm speaking with Ray Nardella, the Assistant Director of Resident Life for Student Conduct at the University of Maryland, where he's also a Deputy Title IX Coordinator. Ray is interested in public policy, disability law, grassroots organizing, and most importantly, coffee from Dunkin' and Wawa. I have known Ray for almost a decade now, about a solid 8 years. We met at the Tim Howard Leadership Academy back in 2016, and we both started as staff that year. Some fun facts about Ray's background. So he is a justice of the peace. So he can officiate your wedding or give you a parking ticket. He's a notary public in the state of Maryland, and he's a certified clinical military counselor. Ray, it's great having you on the podcast here.
Yeah, Mike, I'm really excited to be here. And like you said, it's going on a decade of us knowing each other, and happy to jump in and chat.
Likewise, glad to have you on here. The big topic to kick things off is accommodation. We put a lot of resources and talk and planning into supporting young people with Tourette, children, young adults. As you and I have both said before, there's a lot of opportunity to speak to the young adults and also adulthood. And at that's a point where many of us are going back to grad school, or we're in grad school preparing for those final exams. I know you had the experience of taking the bar exam. I know people doing GRE, GMAT. I think it could be interesting to talk a little bit about what that process can look like for someone with Tourette or another condition where you might be considering getting accommodations. Sort of best practices for that, how you manage that. Can I use the same paperwork I used in high school to get me the SAT stuff? Yeah, would love to just kind of open it there with a broad question and let you take it from there. I know you have no shortage of brilliant ideas here.
I appreciate the kind words, Mike. And yeah, it's accommodations. It's one of those things that are so multifaceted. And like you said, having accommodations in high school typically is vastly different than employment and in college and in grad school, etc. In high school, we often have either IEPs or 504 plans, something to that effect. And usually it's worked on with a school psychologist or a school counselor. That typically is almost 100% different than what that looks like. And I'll start with college and then I'll kind of go up from there, but I shouldn't say 100% different. Maybe there's some similarities. Folks could definitely use their same physician or their same counselor or social worker to work on documentation with, but the process by which somebody is seeking those accommodations is 180 degrees different. The law mandates in our pre-K through 12 education system, especially in public schools, counselors and social workers and teachers are required to seek out those students who they think might be disabled or have a disability, Tourette's, ADHD, autism spectrum, mobility issues, right? It ranges the spectrum. In post-high school world, for the most part, there's some exceptions to that, but for the most part, in the post-high school and post-secondary school world, it's incumbent upon the student themselves or the person or the employee themselves to do just that. So when you go off to community college or a four-year school or graduate school or law school, medical school, insert the military, whatever the case is, insert vocation here, it's going to be up to that individual person to say, this is what I might have had in high school and middle school. This is what I want to have in college or at work. It's up to me now to do that. Mm-hmm. And that's a really big mindset change, right? That's very different. And it can be tough. It'd be really scary to say something that my school counselor or my school psychologist or social worker might have done for 12, 13, 14 years is now up to me. Good news is it's not all up to me, right? Like the first step rests with me. And right now I have to say, I am going to go to my disability resource center. I'm going to go to my supervisor, to HR, to human resources, and apply for these accommodations. But the systems in place are there to help. Important to recognize that even though I don't want to say the burden, but even though the impetus rests with me now instead of those who are kind of working with me, there still are systems in place to help out.
That's a big thing for kids to adjust to. Yeah, the onus is a lot more on the individual as you go through life and advocate for these things. When it comes specifically to some of the graduate school exams, like the GRE, GMAT, accommodations are available for those. How do we go about getting those?
I would emphasize starting early. I think the first step is working with your psychologist or your psychiatrist, your diagnosing professional, whoever you've been working with, to get your Tourette's diagnosis, to get any comorbidity diagnoses. Continue working with them. You'll need documentation. Typically, it's a little more advanced than what you'll need in the system when you have your IEP or your 504 plan. Typically, they're going to want to specifically know what you're not able to do based on your disability, in our case, based on Tourette's or any comorbidities. So it requires a little more, it really boils down to administrative paperwork on the doctor or the psychologist part. But a lot of the process itself is similar to getting accommodations in school. I'd say start early. I'd say any kind of exam that you're taking, whether it's the SATs, the LSATs, the GREs, the MCATs, whatever professional exam you're taking for school, they're required, again, by law, by the Americans with Disabilities Act and Section 504 of the Rehabilitation Act, to have accommodations for folks with disabilities. Going back to that mindset, it's going to be up to the person taking the exam to seek out how to contact either that office or that board or whatever folks are in charge of the disability accommodations. And you usually could Google like SAT, disability accommodations, GRE, disability, and it'll pop up who exactly is in charge of that. But it's going to be up to that person to do that. And it's going to also be up to that person to work with their doctor or their counselor to get that documentation. I'd say have a really good idea when you're talking to your counselor or your doctor as to how your tics or your comorbidity symptoms will directly affect your ability to sit for the SATs. Do you have a tic that looks like you're cheating? Because that was one of my tics.
Yeah, you're looking around or you're...
Yep. Yeah, actually, I took the bar exam during COVID. That's when everything was virtual. And for my budding attorneys and who are listening, I highly discourage taking the bar exam virtual. I don't even think you can anymore. But when I took it, it was at the height of COVID. And because of the software that I had to install on my computer to take it, it actually flagged me for excessive movement, which of course I have excessive movement. That's who I have. That's part of the game, right? So it flagged me for that. And I had to go through tons of appeals processes and paperwork, the bureaucratic process to try to convince a very ableist group of folks as to why I wasn't cheating. But that goes back again to having a good understanding of your tics or your symptoms, whatever your symptoms are for any, like I said, comorbidity. Is ADHD getting in the way of, there's the cat.
We got to keep like that.
Are your ADHD symptoms getting in the way of being able to sit down and concentrate for more than 5 minutes? That would be a direct interference with the test. So having a good idea of how your symptoms were getting in the way, starting early. Also, letting your physician or your counselor know exactly what kind of exam you're taking. I think sometimes folks will say, can I have this blanket letter of accommodation that covers everything? You really want to steer away from that. You really want to try to, first of all, it's likely that you're paying for this letter, or your insurance is paying for this letter if you're working with a physician or a social worker or counselor or whatever. So working with your practitioner to make sure they understand the nuances of the test. They're going to understand the nuances of Tourette's or ADHD, OCD, etc. So it's going to be up to them and up to you to piece those two things together so that they can come up with a very unique and adaptable packet of documentation for the exam committee. So really having a good idea of your unique situation in your test. I'm Ray Nardella. I have Tourette's, OCD, and panic disorder, and I'm sitting for the bar exam. And difficulties I'm going to have are that my tics are doing ABC, my movements are doing XYZ. So again, having that very succinct and connected ability to present information is going to be important.
I imagine you also have the ability to upload proof that you've been receiving accommodations already. I think it was in high school or so. Sometimes this can be helpful at basically establishing a pattern or a history of you having gotten these and used them.
It's not easy to get accommodations. There's a lot of paperwork that goes into it. There's a lot of tests and assessments that you have to go through. I know a lot of students who I work with who actually didn't even have a diagnosis, a formal official diagnosis before they chose to go through the accommodations process, and they have to get a diagnosis out of that, which is great because having a diagnosis is really powerful. And it's usually not cheap, right? So it's usually a privilege to be able to go through the process to have that. So if you are going through that, work with your, at least at the college level, work with your counselors there, work with folks to make sure that you're setting yourself up for success. Typically, like you said, there will be a portal. When I did it back in the day, I graduated college in 2011. But when I did graduate, when I was in college and I had my accommodations, I met with a counselor one-on-one. Typically, there will be a one-on-one interview or meeting, either virtual or in person. They'll go through your paperwork and they'll determine what accommodations make the most sense. A common misnomer is that somebody who has a diagnosed disability could have all the accommodations in the world. That's not true, right? There are accommodations that are reasonable, accommodations that make sense given a diagnosis. In my experience, typically they're fair accommodations and they help folks get to sort of an even playing field, but they're not going to be unlimited accommodations. But yeah, like you said, usually there's a portal you could upload information to. Usually you'll have a one-on-one interview with a counselor from Maryland. We call it the Accessibility and Disability Services, but every institution has their own specific office that's called something a little different. I know at my undergrad, it was called the Disability Resource Center. So making sure you touch base with those folks, have your documents ready if you already have them. But I would really caution folks not to rely just on high school documentation because of the intricacies that you're going to need in college, right? You might need something in your dorm that's totally different from what you need in your classroom. That's totally different from what you need in maybe Student Government Association. If you're in this SGA and you want accommodations, you can get those, but those might look different. Have a good idea of your individual needs and go from there.
Love that. No, that's great advice. And actually segues well into the next question, which is similar. How does it work in the corporate world for jobs? If you could walk us through what that process looks like when you're on the job looking for accommodations.
Yeah. Sometimes we get so caught up in accommodations for school and education, as we should. It's really important. But sometimes I think employment accommodations, I know I didn't take advantage of them as much as I could have, just because it seems like this daunting bureaucratic process. And spoiler alert, it is. But that's not to say we shouldn't go through them. And it also very much depends on individual places of work, right? It's not always daunting. I was just trying to.
I've seen it in many cases be easier and less. It was faster than it is for students. It always depends. And this is all
depends, yeah.
But I have definitely seen some cases where it was very smooth. You're like, wow, I wish it were this easy in college.
Honestly,
it always varies.
I've had the privilege of working at large state agencies all my career. So sometimes it's a little bureaucratic.
Eyes to dot, T's to check, and paperwork. And
there is, but it's not to say that you won't be approved. It really does depend if you work for the government, if you work for a private employer, if you're self-employed. You have all the accommodations you want. But there's a few different laws that protect folks in the employment sector. So the Americans with Disabilities Act is one of them. In educational settings, so if folks work in an educational setting, it could be anything from a daycare to a large university to a community college to, in some cases, even a hospital or in some healthcare sectors, you might be protected by Title VII and Title IX, depending on what your exact disability is and depending on where you work. But start with having a conversation with your supervisor, your direct supervisor. Could be a little bit of a daunting conversation depending on how your relationship is with your supervisors. And contrastly, it could be a fine conversation, right? I know sometimes I've worked with folks who are like, my supervisor don't know how they're going to take it. Like, I want them to be able to trust me. And a lot of those worries come into play. Well, are they going to think the same of me? Are they going to think that I'm not able to do my job? All this stuff. It really is similar to the advice that we give folks when it comes to things like dating and it comes to things like disclosure to teachers. It's really not too much different than that. Disclosing to your supervisor and trying to get the confidence to have that conversation is important. Usually when you have that conversation, they will connect you with human resources. And you're going to know a lot more of this than I will just because your HR background. But typically from there, they'll work with you to try to figure out what accommodations you need. Is it advisable based on your counselor or your doctor to virtually work 2 days a week instead of go to the office 5 days a week? Do your tics get in the way of keyboard use on a computer? And are there technological accommodations that your employer could offer to help you with that? Does your OCD impair you to the extent that you can't, I don't know, for example, have an office near a restroom, right? Could you have an alternate office location? So all these different things that take into consideration, but the thing to really highlight is you're going to know yourself the best, right? Very similar to what we tell folks in a lot of other aspects of Tourette advocacy. So starting with your supervisor, they should connect you with HR. The other really important thing to know is we talked a lot about your individual workplace. The ADA gives very specific parameters for when accommodations could kick in. Usually if there's more than 10 people working at a place, in some cases, it's more than 100. I would advise folks to really check in with their HR department or manager or whoever runs their human resources functions to get an idea of how their company is classified or how their workplace is classified, because a government agency is going to look different than a restaurant, which is going to look different than an office setting. So working with your supervisor, your human resource department to A, let them know what accommodations you need. B, see where their company or their workplace falls in the ADA categorization so that they could have a good idea of what they're entitled to. And then C, working with your counselor and your doctor to get that paperwork for accommodations.
I have a legal follow-up question here. I'm going to put your law degree to use here.
Oh, geez.
It shouldn't be a hard one. If I want to get accommodations at my place of employment, do I have to disclose the name of my disability?
No. It's a really good question. You don't. And employers can't legally ask that question. When I was talking before about framing, disclosing, that's obviously a very sensitive topic, and folks should absolutely feel empowered to disclose when they want. There's not a legal obligation to disclose. There is a legal obligation to get documentation from a physician or a counselor, but that could be as simple as, dear company, Ray needs accommodations. Those include working virtually 2 days a week, right? It might be it should be a little more in depth than that, but the employer cannot legally ask any follow-up questions, right? Whatever is in that documentation is in it. If the physician or the counselor or social worker in turn is like, you know what, in order for Mike to have these accommodations, his workplace should really know he has Tourette's because there's too much of a nexus there, too much of a crossover for them to not. That'll be up to the physician and you to have that conversation. But if the physician or the counselor is like, no, we can give you these accommodations and disclose minimal information, then the worker is not legally obligated to do that. Yep.
No, it makes sense. I mean, I imagine in many cases, it's probably easier for you if you can disclose that and give them that information. But again, that's your right. Whether you share that or not is your choice. One resource I recommend is a really good website called askjan.org. ASKJAN.org stands for Job Accommodation Network, the JAN acronym. What's neat about that site is there's templates and stuff on there where if you just want to do all this in writing, you can send a message, an accommodation request to HR over email using a template on their site. They make it very easy. They also have on their homepage, you can sort basically by diagnosis, and Tourette syndrome is one of the ones listed. You can go to their Tourette syndrome page and it lists out specific accommodations that have helped many people with Tourette in the workplace. And it's not an exhaustive list, but actually is pretty lengthy. There's a lot of great examples on there, ones I had never thought about. And you could even print that out and bring that into to your employer as well as part of your discussion around, hey, I think this would really benefit me and here's why. It's just a great wealth of information on accommodations for your specific diagnosis, along with templates you can use to get that conversation started. So that's askjen.org. I do recommend them. It is a good resource. There's also Q&As on there, like what can you do if the company says no or for some reason, when you get pushback? And then how do I handle that? There's templates for the physician too, to make it easier. I was pleasantly surprised to find that a lot of physicians, like when you ask them for that accommodations letter, I mean, I can't promise your experience will be like this, but a lot of times it's pretty straightforward. So if that helps alleviate any of the stress or anxiety people might have in going through this process, know that asking your doctor for the accommodations might be the easiest part because they probably have a template they use already for this, and they put your name on it and some notes about you and your background, and they'll print that off, send it to you, and you give that to your company.
The scariness sometimes of talking to somebody's supervisor, I think sometimes originates from a skill set deficit, right? Like if I go to my supervisor and I say, I can't control my tics, I need this accommodation, are they going to think I'm less than, right? I notice that a lot with folks sometimes. And I think some of it is being aware of the relationship you have with your supervisor. And if it's not a great one, going to somebody else in the company could be really good. But sometimes I think it starts with that. Oh my gosh, I don't want them to think I'm not able to do
they write my performance review. I do care about what my boss thinks of me, and I am nervous having to bring up things like this, and those are very normal feelings, like typical common feelings to have. Any other thoughts come to your mind around accommodations, either in the workplace or higher education, anything like that?
Well, I would really encourage folks in general to take advantage of accommodations. Whenever I'm doing advocacy work in Tourette's, I'm talking a lot about this idea that we have, in a lot of ways, have a disadvantage, right? Because of different things that we're going through, different life situations, different diagnoses. So the concept of accommodations, especially in education and in the workplace, are put in place for a reason. There's a legal reason, there's a social reason, but they're put in place for a reason. And whenever I'm talking to somebody, they're like, yeah, I have all these symptoms, but I'm not going to use these accommodations because it's too burdensome of a process or because I don't think they'll be approved. I really can't stress enough to really consider using. In a lot of folks who I work with, students and otherwise, they really have been the make or break, right? Like in a successful career as a student or an employee. And that's what they're there for. They're there to make sure folks are successful, to make sure folks are given an equitable lens to do their work in. So I really, I can't stress that enough.
Use the tools and resources that we have, whether that's therapy, whether that's medication, whether that's accommodations. We wouldn't tell a visually impaired person that they can't wear glasses or have a walker. So these are the tools that we have to help us function in a neurotypical world. Use them if you think you would need them and benefit from them.
The really other quick thing I'll say about accommodations is typically we look at them in terms of education and employment, but we have accommodations in housing. We have accommodations in travel and transportation. Basically every sector of society you could think of, they'll be, in large part because they legally are required to, right? There'll be an opportunity to seek some kind of accommodation. Sometimes we think of, like you said, mobility concerns or stuff like that as being the disability that, lack of a better phrase, should take precedence, but symptoms vary so much from individual to individual. So making sure that wherever you're at in life, school, work, on the subway, right, on the train, flying, going to sign a lease for an apartment, there's legal rights that you have as a disabled person there too. So really making sure that you're educating yourself is important when it comes to accommodations.
Ray, you're familiar with the TSA Cares program, I assume?
I am.
I know Ben, who's also been on our podcast. Yeah, he's a big advocate of it. He's always first told me about it. He uses it. TSA Cares, anyone listening in, is a program that you can use with a lot of different conditions, I think, qualify for it. Mm-hmm. Basically, they assist you in navigating airports, getting to your flight, getting through security. So if you have panic disorder or significant anxiety or tics or anything that could make navigating an airport difficult, that's a program that you might want to consider looking into, signing up for. They can meet you at the entrance to the airport, make sure you get through security. I think it means you bypass the lines. I don't know, but I think there's something about that. Don't quote me on it, but you feel like a personal assistant kind of helping you around. I mean, even things like that and I bring that up because it's something as like maybe specific as that. We have accommodations there. There's a lot there. Make sure that you carry your Tourette card through NJCTS or another Tourette organization. So if you're pulled over by an officer or something like that, you have that documentation there. This could actually lead into a broader conversation around just like what are our rights as people with diagnoses. And Ray, I think this is something you could speak to. I'd love for our listeners to learn what their rights are, and then also any other programs that may serve people like us that we may be interested in.
When I think of rights as folks with disabilities, I think society and our legal and political system trying their best to get us on the same level as folks without disabilities, right? Philosophically, that's what disability law entails, right? It's equitability. It's getting us to the same playing field as our non-disabled counterparts. And like I mentioned, there's rights we have in so many different sectors of society, right? We talked a lot about accommodations. I even think of things ranging from economics, right? So there's special savings and checking accounts that folks with disabilities could take out that are unique to folks with disabilities, right? I'm not sure of the exact functional nature of it, but they're unique to folks who have disabilities, and there's benefits involved there. Don't ask me about the economics part of it because I'm not a math person, but I think there's a little bit higher yield and higher like interest that goes into it. And one of the most sort of typical things we do is we sign a lease for an apartment or a condo or something like that. We have legal rights in place there. Whether it's a mobility issue, whether it's cognitive, a learning disability, there's rights that go into what unit we could possibly get based on our disability. I think of parking, right? There's disability tags. That's a very sort of common example, but there's also more nuanced things like sensory friendly parking. There's so many different things nowadays that are sensory friendly, which is fantastic. But I think that's starting to sort of permeate a lot of aspects of society too. But yeah, that's kind of a word dump of things I could think of now. But know your rights. There's a lot of laws and policies that govern disability rights, and it's not all the ADA. It's not all Section 504. There's parts of sexual misconduct laws that have to do with disability. There's part of employment and race and gender discrimination laws. There's a lot, right? Making sure you're educated on stuff, and doesn't mean you have to go out and be a disability lawyer, but it does mean that, like you said, right before you fly, doing your research and saying, oh, TSA Care, this is pretty cool. I could use this to navigate the airport. I could use this to navigate the train station. Fun fact, oftentimes when it comes to transportation accommodations, oftentimes, this isn't the case everywhere, but all you'll need is a disability card for a regional transportation system, and you could use it at any transportation system in the country. So, for example, in New York City or New Jersey, you might have a disability card for the New Jersey transit system. You could use that when it comes to accommodations to fly, to go on like ferry boats, to go on like the Amtrak. And knowing things like that could be really, really helpful and beneficial in the long run.
Wow. No, that's a really good point. Look up those reciprocal where you can use those as well, other places. I'd heard that's true with some of the disability Metro card for New York City subways. I can use that for Metro North and trains, Amtrak. Yeah, keep an eye on that. And actually, you mentioned disability lawyers. If you ever, hopefully it doesn't happen to any of our listeners, but if you feel you've been wronged or you are in need of a disability lawyer, one place you can go to is the National Disability Rights Network, the NDRN. They have chapters in each of the states. It may be called something different in each state, maybe a little state specific, but you want to look them up. They can find you private or public attorneys. They can also hear your case, see if you even have a case that someone could take on and work with you on. They can provide legal counsel and advice, but you'll want to look up Protection and Advocacy, P&A. Each state has one, and you can find help there to ensure that people with disabilities get their rights.
Never be afraid to ask an attorney if they'll take you on pro bono. Pro bono means for free. For purposes of community service and volunteering, attorneys have to meet a certain number of hours per year to stay licensed of pro bono work. So if you, like Mike said, if you want a private attorney, but like, yeah, I can't afford a $3,000 retainer and then $500 an hour thereafter, talk to them and say, listen, my case is relatively small. Would you consider taking me on pro bono? The worst they could say is no. The best they could say is yes. So
Also, check your bar association for your state. I did this once. I live in New York City, and in New York State, I went to the New York Bar Association's website, and they had a form you could fill out to kind of request an attorney. And I put in my situation, I described what happened and everything, and they connected it. I don't know what back end magic happened, but they connected it to an attorney that they thought could handle that case. I got like an email from them or something with a confirmation code. They said, give this code to them because that's your referral from the ABA. And I ended up not moving forward with that. But I would assume other states have similar kinds of programs like that. So go on your state's bar association website and see if you can fill out a form, because they might be able to take that, help you take that first step in contacting someone affordable and that can work with you on this.
I would also add legal clinics at law schools.
Yeah, legal clinics. Yeah.
Legal clinics could be a fantastic way to do exactly that as well. You're meeting with student lawyers who are supervised by a licensed attorney, and yeah, they could do a lot of that good stuff.
Do you have any good tips on getting in touch with them? Like I could Google NYU legal clinic, but I don't know who to reach out to. How do I get started doing that? That's I'd love to hear your thoughts on that.
It's tough sometimes because legal clinics aren't always advertising their services. Sometimes they do, but sometimes they don't. I would start by going to the faculty page for a law school. So like, for example, NYU Law, Rutgers Law, whatever the case is, go to their faculty page. In their faculty bios or their titles, it'll list who the director of an individual clinic is. So if you see Professor John Smith, director of the Disability Rights Legal Clinic at Rutgers, I would start by reaching out to them, right? Because they're usually the ones who could get you in touch with other folks, especially when there's not a clear-cut way to get in contact. Usually clinics won't have like a form you could fill out and say, oh, could a student attorney get back to me? Usually legal clinics are more proactive. So they're going out in the community and finding work. They're setting up, they're at legal fairs, they're doing disability paperwork and IEP stuff. But that doesn't mean they won't take on clients who need their services, especially if they're financially unable. So I would say start with their director, or even if it's a random faculty member in that clinic, it'll list their affiliation in their title on the law school faculty website. And I would start by emailing them. And usually they're responsive.
Really good advice. In a lighter note here, Ray, I know you and your wife are expecting soon.
Yes.
How are you feeling about all of it?
Ooh, I'm excited, nervous, happy, all the emotions, all of the Maslow's emotions.
Yeah, I bet. I know. I imagine it's a whirlwind. Congratulations on that.
Thank
That's
you
exciting.
so much.
When's the due date?
She's due August 5th. I do think she's going to go early, though. She's in back of me now. I think she's going to go early. So really, anytime between now and early August, we'll have a little daughter. So.
Wow. Oh, that's wonderful. I wish you and your family the best with that.
Thank you.
Probably on your mind, just with getting ready to have a child here. This is such a big question and a broad question. I don't know how to just ask it, but how do you set a kid up for success? What are your thoughts on what's the Ray Nardella philosophy on being a good parent?
I think my wife would be interested in that too.
Get her advice too.
Yeah. You mean a kid with Tourette's or a kid in general?
More broadly. I didn't want to just limit it to that, but if you could speak to that, absolutely. I would love to hear how you would raise a kid with Tourette's, but just what are your thoughts on parenting and transitioning into that?
Well, I think it's going to be go as you do kind of thing. A lot of my father friends in my circle are giving me advice, and they're like, honestly, the best piece of advice is just you're gonna learn it as you do it, taking it second by second. I almost said day by day, but it has to be more granular than that. It's second by second. Me and my wife have an amazing partnership and relationship with each other, which is why we're married. We probably wouldn't be married if we didn't.
Married too. Yeah, that's always
yeah. So having that partnership and having that relationship and that co-parenting relationship is going to be so special and important. And I think it's just knowing that you're going to make mistakes, right? You're not going to be perfect. This is our first. So it very much will make all the mistakes on her, and then subsequent children will be perfect for her. So
yeah, the next one you'll be
No, I think the success I think will just be loving unconditionally and co-parenting in a good way and just knowing that we got this.
Thinking back to your own childhood, I mean, a little bit about how your trip began.
Definitely started showing signs around 6 or 7. Like a lot of other folks, it was chalked up to behavioral, right? He's acting out. He's doing all this stuff that is more so cognitive behavioral nature. So I was diagnosed at 12 by the infamous Dr. King. He's a fantastic practitioner. I've had the pleasure of working with him pretty closely at the academy and otherwise. But I moved on and I was prescribed medications, and we did some work with my middle school and my high school. But what I always tell folks is I was so against having it. I was like, I do not have it. You might tell me this, you might give me this diagnosis, but there's no way. I don't have it. I don't care that you're a doctor with 30 years experience. I don't have it. That's just me moving my head a certain way. And I actually kept that mentality until honestly early college. It wasn't until then where I was like, okay, I have this. And then I started doing advocacy work, did my graduate work in counseling. So I studied Tourette's more and more on a scientific level. But I, got diagnosed at 12, but I don't know what it's like to not have it. So.
That's what we hear a lot. Yeah. That's all we know. Is there anything that we're not doing any parent bashing or anything here, but anything that you've learned from your childhood that you would do differently for your own kid? Let's suppose you have a kid that has tics or something in that, ballpark.
Yeah, it's a really introspective question that I have been thinking a lot about. I've talked to my wife and I have talked a lot about it. And I think it's helpful that we know what to look for, because with me, I was the first one in the family to have, I'm still the only one in the family to have it. Although when my brother inevitably listens to this, Matt, I'm pretty sure you have it too. So I'll just get that out there now.
It's probably ticking right now. Just
right.
Comment.
But, I think looking out for it and being able to monitor in a way that we know what to look for is going to be so critical. I mean, NJCTS has been an amazing set of resources that I've had in my life since 10 years ago or so. And I think tapping into those resources, if our daughter does have Tourette's, is going to be really helpful. And I think my parents did this too, but empowering my daughter to be herself, to advocate for herself, to know she's amazing regardless. And I'm not going to say my parents didn't do that, because they did. Delineation between my upbringing and my daughter's, if she does indeed have Tourette's, will be that we know what to look for, right? And we know what to spot it, and we know where to go if she does, and we know how to treat it and all that stuff. So I'm really thankful, because epidemiologically, I think all of us with Tourette know the statistics, the chances. So it's something that we're mindful of, and if she has it, we'll deal with it. If she doesn't, we'll still welcome her in the NJCTS.
Yeah, it's still allowed in the Tourette's Friends.
Right.
And Tourette's Club here. No, I appreciate you saying that, and good wisdom and thoughts as always. Any last minute pieces of wisdom or advice you wish to impart to our audience?
I say this all the time to our friends at the academy, but be yourself. Being somebody else is boring, and it sucks. Be yourself. Know what you need. Advocate for it. And know that there are things in place in society to help us. And don't be afraid to use them.
Ray, it's been great having you on the podcast. Thank you so much for joining.
I'm very happy to do it. Thank you, Mike.
Thank you for listening to The Uptick, brought to you by the New Jersey Center for Tourette Syndrome and Associated Disorders, empowering you to stretch the boundaries to live your best life. The NJ Center for Tourette Syndrome and Associated Disorders, NJCTS, its directors and employees assume no responsibility for the accuracy, completeness, objectivity, or usefulness of the information presented on this podcast. We do not endorse any recommendation or opinion made by any guest, nor do we advocate any treatment.